Thank you for joining me today as I present to you 5 things that you can do now as a healthcare provider to protect your reputation. We all know that it takes a considerable amount of time and investment to build a reputation, but a reputation can easily be destroyed. By not following certain federal regulations, you run the risk of fines, legal fees, and downtime. But more importantly, you lose reputation, which is the greatest cost. So let's focus on what you can do now to protect your brand and your reputation. Covered entities must provide their notice of privacy practices to the individual patient no later than the date of first service delivery, except in emergency treatment situations. A good faith effort to obtain the individual's written acknowledgement of receipt of the notice of privacy practices must be documented. Additionally, the notice must be posted in a clear and prominent location at the facility. The best location is often the waiting area of the practice, as all patients spend some time there. Finally, the notice must be prominently posted and available on any website that is maintained and that provides information about customer services and benefits. Incidental disclosure is a byproduct of doing business in the healthcare field. While the HIPAA rules don't require us to eliminate it completely, they do require that we mitigate such disclosures. When patients arrive for their appointments, offering them some level of privacy is important. Having patients signed in so that you can check them in one at a time is a very good way to help prevent incidental disclosure. Additionally, the use of white noise or music can help to distract those who are waiting from conversations that are happening at check-in or check-out.
Mrs. Fields, I'm just reminding you of your annual checkup for your pap smear.
Continuing with our conversation about incidental disclosure, we must also think about conversations we have with patients and other providers or over the phone. Make phone calls away from any desk facing the waiting area and consider having conversations that involve patient information in private areas.
Hi, Mr. Brown. Is your main reason for coming in today erectile dysfunction?
Yeah.
It is important that covered entities protect patient information against impermissible disclosures. Impermissible disclosures often happen in offices where patient data is left unattended. Make sure that you maintain control of all patient information. Don't leave it sitting unattended at check-in or check-out. Take all patient data and portable devices with you when you leave exam rooms. And as a reminder, make sure you lock unattended sessions on other workstations as well. Practices must implement procedures that terminate an electronic session after a predetermined time of inactivity. Additionally, employees should log off the system they are working on when their workstation is unattended. Many applications have settings for automatic log-off that ensure that after a predetermined period of inactivity, the application will automatically log off the user to help prevent unauthorized access. In conclusion, you can do these 5 things now to help protect your healthcare practice's brand and reputation. Make sure your notice of privacy practices are visible in the waiting area and on your website. Make sure your computers are attended and patient information cannot be viewed on monitors. Make sure your waiting area and check-in area are designed for quiet conversations. Make sure you cannot hear office or medical staff talk to patients on the phone at the front desk. And finally, make sure patient information like files or papers are not visible in the front desk or other areas. Thank you for listening. For more information on how you can protect your brand and your reputation, please contact Centrovance Consulting today. We can give you a free, simple risk assessment today and get you on your way to peace of mind knowing that you are doing everything you can to protect your brand and your reputation.